Welcome back. I'm Professor Piivand Pirouzi. Today we cover Module 5, Clinical Study Reports, the heart of your IND application. For initial INDs, Module 5 primarily contains your clinical protocol. As development progresses, it accumulates clinical study reports that demonstrate your drug's safety and efficacy. Example Protocol Title Page. Protocol NPT 2847-001. A Phase 1, randomized, double-blind, placebo-controlled, single ascending dose study to evaluate the safety, tolerability, and pharmacokinetics of NPT 2847 in healthy adult subjects. Version 1.0. Date, January 5, 2026. Sponsor: Novapharm Therapeutics Incorporated. 123, Research Boulevard, Cambridge, Massachusetts, 02142. Medical Monitor: William Roberts, M.D. Phone, 617-555-0130. Sponsor Signatory: ___________________________________________________________________________________________________________ Sarah Chen, Ph.D. VP, Regulatory Affairs. Date, _____________________________________________________________________________________________________________________ Analysis. Study title, Phase 1 SAD Study of NPT 2847. Objectives. Primary, evaluate safety and tolerability of single ascending SC doses. Secondary, characterize pharmacokinetics, assess immunogenicity. Design, randomized, double-blind, placebo-controlled, single ascending dose. Population. N equals 48, 6 cohorts times 8 subjects, 6 active, 2 placebo. Healthy adults, 18 to 55 years. BMI 18.5 to 30.0 kg per square meter. Dosing. Cohort 1, 1 mg SC. Cohort 2, 3 mg SC. Cohort 3 10 mg SC. Cohort 4 30 mg SC. Cohort 5, 100 mg SC. Cohort 6, 200 mg SC. Duration, single dose on day 1, follow-up through day 85. Endpoints. Primary, incidence and severity of AEs. Secondary, PK parameters, Cmax, AUC, T1/2, ADA incidence. Example inclusion criteria. 1. Adult males or females aged 18 to 55 years, inclusive. 2. Body mass index, BMI, 18.5 to 30.0 kg per square meter, inclusive, with body weight greater than or equal to 50 kg. 3. Healthy as determined by A medical history with no clinically significant findings. B. Physical examination within normal limits. C. Vital signs within normal ranges. D. 12-lead ECG with no clinically significant abnormalities. E. Clinical laboratory tests within normal limits or judged not clinically significant. 4. Female subjects must be A. Of non-childbearing potential, surgically sterile or postmenopausal greater than or equal to 12 months, or B. Of childbearing potential with negative pregnancy test and willing to use highly effective contraception from screening through 90 days after dosing. 5. Male subjects with female partners of childbearing potential must agree to use contraception through 90 days after dosing. 6. Capable of providing written informed consent. 7. Willing and able to comply with all study procedures. Example exclusion criteria. 1. History of any serious infection requiring hospitalization or 4 antibiotics within 6 months. 2. Active or latent tuberculosis, or history of TB regardless of treatment. 3. Positive test at screening for hepatitis B surface antigen, hepatitis C antibody, HIV-1 or HIV-2 antibodies. 4. History of severe allergic or anaphylactic reaction to any biologic agent. 5. Prior exposure to any anti-IL-17 therapy. 6. Receipt of any vaccine within 4 weeks prior to dosing. 7. Use of any prescription medications within 14 days, except contraceptives. 8. Use of any investigational drug within 30 days or 5 half-lives. 9. Pregnant or breastfeeding females. 10. Current smoker or use of nicotine products within 3 months. 11. History of alcohol or drug abuse within 12 months. 12. Any condition that would confound study results or pose risk to subject. Example dose escalation scheme. Safety Review Committee, SRC. Composition, medical monitor, sponsor safety physician, biostatistician, study PI. Escalation criteria. 1. Minimum 7 days must elapse between dosing of sequential cohorts. 2. At least 6 of 8 subjects must complete 7-day safety follow-up. 3. SRC must review a. All adverse events. b. Clinical laboratory results. c. Vital signs and ECGs. d. Available PK data. 4. Escalation proceeds if no serious adverse events related to study drug. No dose-limiting toxicities, DLTs. No safety signals of concern. 5. Dose-limiting toxicity defined as any grade 3 or higher AE considered related to study drug. Any grade 2 AE that does not resolve within 7 days. Clinically significant ECG abnormality, e.g., QTCF greater than 500 milliseconds. 6. If 1 DLT occurs, expand cohort by 4 additional subjects. If greater than or equal to 2 DLTs occur, previous dose declared MTD. Example safety assessment schedule. Visit schedule. Screening, day -28 to -1. Day 1, dosing. Day 2, 3, 4, 5, 6, 7, daily visits. Day 14, 29, 57, 85, follow-up visits. Assessments. Cardiac monitoring. Continuous telemetry, pre-dose through 24H post-dose. 12-lead ECG, triplicate pre-dose, 2H, 4H, 8H, 24H, and each follow-up visit. QTCF calculated using Friederichs correction. Vital signs, BP, HR, temp, RR. Day 1, pre-dose, 0.5, 1, 2, 4, 8, 12, 24H. Days 2 to 7, once daily. Follow-up visits, once per visit. Clinical laboratory. Hematology, chemistry, urinalysis at, screening, day 3, 7, 14, 29, 57, 85. Injection site assessment. Local tolerability scale at 0.5, 1, 4, 8, 24H in days 2, 3, 7. Adverse event collection. Continuous from first dose through day 85. Example PK sampling schedule. Pharmacokinetic blood sampling. Day 1. Predose, within 30 minutes before dosing. 1 hour post-dose, plus or minus 5 minutes. 2 hours post-dose, plus or minus 10 minutes. 4 hours post-dose, plus or minus 15 minutes. 8 hours post-dose, plus or minus 30 minutes. 12 hours post-dose, plus or minus 30 minutes. 24 hours post-dose, plus or minus 1 hour. Day 2 48 hours post-dose, plus or minus 2 hours. Day 3, 72 hours post-dose, plus or minus 2 hours. Day 7, 144 hours post-dose, plus or minus 4 hours. Day 14, 312 hours post-dose, plus or minus 8 hours. Day 29, 672 hours post-dose, plus or minus 24 hours. Day 57, 1344 hours post-dose, plus or minus 24 hours. Day 85, 2016 hours post-dose, plus or minus 24 hours. Total samples, 17 per subject. Sample volume, 4 milliliters whole blood, yields 2 ml serum. Total blood, 68 milliliters for PK. Bioanalytical method, validated ELISA. LLOQ, 0.1 μg/ml. Example stopping rules. Individual subject stopping rules. 1. Any grade 3 or higher AE considered related to study drug. 2. QTCF greater than 500 milliseconds or increase greater than 60 milliseconds from baseline. 3. Severe injection site reaction, greater than 10 cm in duration/erythema. 4. Anaphylactic or severe hypersensitivity reaction. 5. Subject request to withdraw. 6. Investigator judgment that continuation would be harmful. Cohort stopping rules. 1. Greater than or equal to 2 dose-limiting toxicities in any cohort. 2. Same grade 2 plus AE in greater than or equal to 3 subjects in single cohort. 3. SRC determination that safety profile is unacceptable. Study stopping rules. 1. Death of any subject considered related to study drug. 2. Serious adverse event in greater than or equal to 2 subjects considered related. 3. Unexpected serious adverse reaction, SUSR. 4. SRC, medical monitor, or sponsor determination. 5. FDA request or clinical hold. Upon any stopping event. 1. Notify medical monitor within 24 hours. 2. Convene emergency SRC meeting within 48 hours. 3. Document decision and rationale. Example statistical analysis plan excerpt. Analysis populations. Safety, all subjects receiving any study drug. PK, all subjects with evaluable PK data. Safety analysis. 1. Adverse events. Tabulated by SOC, PT, severity, and relationship. Summarized by cohort and overall. Treatment emergent AEs defined as onset after first dose. 2. Laboratory/vital signs/ECG. Descriptive statistics, mean, SD, median, range. Shift tables, normal/abnormal. Individual values flagged if outside reference ranges. Pharmacokinetic analysis. 1. Non-compartmental analysis using Phoenix Win-Non-Lin. 2. Parameters calculated. Cmax, maximum observed concentration. Tmax, time to Cmax. AUC 0, T, area under curve to last measurable concentration. AUC 0, INF, AUC extrapolated to infinity. T1/2, terminal half-life. 3. Dose proportionality assessed using power model. Log, parameter, equals alpha plus beta times log, dose. Proportional if 95% CI for beta includes 1.0. Sample size, 6 active per cohort provides 80% power to detect 50% difference in AE rates, alpha equals 0.05. Example informed consent key sections. Study title, Phase 1 study of NPT 2847 in healthy volunteers. Purpose. You are being asked to join a research study testing a new medicine called NPT 2847. This is a first-in-human study, meaning NPT 2847 has not been given to people before. We want to find out if NPT 2847 is safe and how your body handles the medicine. What will happen? 1 injection under the skin, like an insulin shot. Stay at the research clinic for 3 days for monitoring. Return for 7 follow-up visits over 3 months. Blood draws, about 17 samples, total 1 cup of blood. Heart monitoring, physical exams, and questionnaires. Risks. Injection site reactions, redness, swelling, pain, common. Infections, because the medicine affects your immune system, possible. Allergic reactions, possible. Unknown risks since this is a new medicine. Benefits. There is no direct benefit to you. The information may help patients with psoriasis in the future. Alternatives. You do not have to join this study. This is voluntary. Confidentiality. Your information will be kept private. You will be identified by a number, not your name. ICHE 3 Clinical Study Report Sections. 1. Title page. 2. Synopsis, structured 2 to 3 page summary. 3. Table of contents. 4. List of abbreviations. 5. Ethics. 5.1 IRB approval documentation. 5.2 GCP compliance statement. 5.3 informed consent. 6. Investigators and study sites. 7. Introduction. 8. Study objectives. 9. Investigational plan. 9.1 Study design. 9.2 Study population. 9.3 Treatments. 9.4 Efficacy/PK assessments. 9.5 Safety assessments. 9.6 Statistical methods. 10. Study subjects. 10.1 Disposition. 10.2 Protocol deviations. 11. Efficacy evaluation. 12. Safety evaluation. 12.1 Adverse events. 12.2 Deaths, SAEs, withdrawals. 12.3 Laboratory evaluations. 12.4 Vital signs and ECG. 13. Discussion and conclusions. 14. Appendices. 14.1 Protocol and amendments. 14.2 Patient data listings. 14.3 CRFs, blank. Module 5 Document checklist, initial IND. Ballot box with check clinical protocol with all required sections. Ballot box with check protocol synopsis. Ballot box with check investigator's brochure, in Module 2 or here. Ballot box with check informed consent template. Ballot box with check dose rationale document. Key protocol elements. 1. Clear objectives and endpoints. 2. Appropriate study design. 3. Defined inclusion/exclusion criteria. 4. Dose escalation scheme with safety gates. 5. Comprehensive safety assessments. 6. Stopping rules at individual, cohort, and study levels. 7. Statistical analysis plan. As development progresses. Add completed study reports, ICHE3 format. Update clinical summary in Module 2. Maintain current investigator's brochure. This concludes our IND CTD module series. You now have document templates and examples for all 5 modules. Remember, quality submissions facilitate efficient FDA review and faster paths to clinical trials.